Hello, and welcome to From the EBPL Archives, Encore presentations from the East Brunswick Public Library. I am your host, Melissa Hosick. This event was presented as part of our Just for the Health of It initiative. Just for the Health of It is a proprietary health literacy program developed by the East Brunswick Public Library to promote health literacy in Middlesex County. To learn more, visit justforthehealthofit.org. Now, enjoy the program.
Welcome and thank you for joining us this afternoon for today's Lunch and Learn. Are you getting a good night's sleep? My name is Kathy Chern and I am a consumer health librarian at East Brunswick Public Library. Today's program is brought to you by Hackensack Meridian Health and the library's Just for the Health of It initiative to promote community health and wellness. Our speaker today is Dr. David Goldstein, Medical Director of the Center for Sleep Medicine at Raritan Bay Medical Center. Dr. Goldstein is a board-certified sleep specialist who conducts continuing education symposiums for physicians on topics relating to sleep disorders, medicine, and regularly provides information sessions for the general public. He currently serves on the faculty at Albert Einstein College of Medicine, where he was appointed Clinical Assistant Professor of Medicine. Please be aware that this talk is being recorded. Please keep your microphones muted and your webcams off. When available, the recording will be available for viewing at ebpl.org/YouTube. If you have any questions, please type them into the chat box. Our speaker will answer questions at the end of the talk. And without further ado, I'll turn things over to Dr. Goldstein.
Thank you very much. It's a pleasure to be here and to join with you. And so I'm going to speak about sleep, sleep in general, some of the sleep disorders, and I hope to be able to answer any questions that people may have. Sleep, I think, is a fascinating topic and a very important topic. And I will start by, this isn't advancing, let me see. Okay. Okay, so what is sleep? Obviously, sleep, everybody knows, it's a state where you have less responsiveness than you are when you're awake. But also what's important is that it's a reversible state. So obviously, if you're sleeping and somebody shakes you or you hear a noise, you could wake up. So it's a state where you're less responsive, but it's reversible. Now, very important that people aren't aware is that sleep is an active process. Many people think that you just go to sleep and everything shuts down and you rest, and then you wake up 8 hours later and you're refreshed. Well, actually, sleep is an active process that is not uniform. Sleep is actually divided into different stages, and things happen at different stages of sleep. Some stages your heart rate is faster, sometimes it's slower. Sometimes of parts of sleep you are dreaming. Sometimes sleep is irregular. Sometimes your blood pressure may go higher during sleep. So it's not just a state where everything just shuts down. It's a very active process. And here are the stages of sleep, the way we group it right now. Basically, it's stage 1, 2, and 3, and the REM stage of sleep. And you don't necessarily go from 1, 2, and 3 into REM. It goes back and forth. So the stage 1 is a stage where we consider that to be light sleep. When you first fall asleep, things start to change a little bit. Then stage 2, which represents probably at least 50% of sleep, occurs. Stage 3 is known as the deep stage of sleep, or the slow wave of sleep. And then REM sleep, which is the rapid eye movement part of sleep, happens also. But again, it doesn't necessarily go from 1, 2, 3 REM. It may go from 1 to 2, back to 1, up to 3, back to 2. Then you have REM stage, and then you go back to 2. You may wake up a couple of times during the night and then go back into the slow waves of sleep and the light stage of sleep, and then go back to 2 and then to REM. The REM stage of sleep, again, the rapid eye movement, named obviously because during that stage of sleep, our eyes go back and forth and move very fast, is also the stage of sleep that we do most of our dreaming. And different things happen during the REM stage of sleep as well. Your breathing may be more irregular during that stage of sleep. Your heart rate may be going up and down a little bit. And it seems like approximately every 90 minutes of sleep, you go back into REM stage of sleep. And the longest period of REM stage is probably before you wake up in the morning. So the early morning hours may be where more of your REM stage of sleep occurs. Well, this is obviously the biggest question, is why do we sleep? And unfortunately, the answer is we don't know yet. There are a lot of theories. Some people think that it refreshes you. Some people say that it organizes your memory. There are other theories that it allows you to be stronger during the day, to concentrate more. But we really don't know why we sleep. Why, by evolution, did we end up sleeping? We do know what happens when we don't sleep. We obviously feel very sleepy and exhausted. During the day, we can't concentrate as well. We may get moody. We may get periods of time where we're grouchy. You can't do certain tasks as well as if you had a full night of sleep. There have been even studies to show that if you don't get enough sleep, you can't quite do everything that you can. There are even people that say, oh, I only need 4 hours of sleep or 5 hours of sleep a night. But if we test those people to do different tasks, they don't do it as well when they had a full night of sleep. So we do know that sleep is important. Again, why it was created, why by evolution are we sleeping? We still don't have the answer to that. How much sleep do we need? Well, it varies a little bit, but on the average, most adults need about 7.5 to 8 hours of sleep. A very common question that I get is, isn't it true that as we get older, we don't need as much sleep? But that isn't true. Basically, adults need 7.5 to 8 hours of sleep throughout their lifetime. Now, it may be harder as we get older to get that amount of sleep. Sometimes people have more aches and pains or some medical problems or even worries that we don't end up sleeping as much as we get older. But the requirement is still there. Children, it varies. When babies are first born, and as they get older, they need less and less sleep. As an adolescent, probably those people need about 9.5 hours of sleep. Unfortunately, most don't get that much. With cell phones and video games and everything else, people don't get quite the amount of sleep that they do when they're in their teens. Now, there's a very interesting thing in terms of the sleep-wake cycle. And I classify that into two things: homeostatic sleep drive and circadian alerting signal. And I bring this up just because it's interesting that a lot of what we do takes place at night, right? 8 o'clock at night. The presidential debates take place at 8 o'clock. If you go see a show after the pandemic is over, the shows that start at 7 o'clock or 8 o'clock, we watch TV, we study at night. And the question is, why are we able to do so much after not sleeping the whole day, after not sleeping for 12, 13, 14 hours, we're still awake? Well, it's because of these two mechanisms. The longer we're awake, the greater there is to go back to sleep, to have the sleep drive. But you also have this thing called circadian alerting signal. There's something in the brain that stimulates our brain as the day gets longer and longer to keep people awake. So at 8 o'clock at night, for example, when the body is saying, oh, it's time to go to sleep, I've been awake that much, another part of the brain is saying, let me stimulate you and let me make sure that you're awake at night. So if you look at this little picture, you can see here's the homeostatic sleep drive. As somebody is awake, there's more and more tendency to say, okay, it's time to go to sleep. But then you have something in the brain that's, as the day goes on, is saying, boy, let's keep you awake. Then sometime late at night, 10 o'clock, 11 o'clock, all of a sudden, something kicks in. A lot of it is melatonin induced in the brain, but something is all of a sudden saying, okay, it's time to go to sleep, in which case that stimulation goes away, but you still have this big drive to go to sleep. And so you fall asleep at that time. And then as the night goes on and you're getting enough sleep, so this process is going away, the stimulation to the brain gets even less to keep you asleep. So you could sleep throughout the night to get your 8 hours of sleep. So I thought I would just speak about some of the sleep disorders that many people have heard about. And we'll go through this quickly. If you have questions later on, I'll be happy to answer them. The first thing I wanted to speak about is obstructive sleep apnea. That is very common, and it's always in the news now. So probably most people have heard about it. What happens as we fall asleep, your muscles relax, including the muscles in the throat. And as those muscles relax, the airway narrows a little bit because the muscles collapse a little bit. Normally, there's still enough airway passage so that you can breathe freely. However, if the airway starts to get even more narrow, you may start to snore. And snoring is just a noise created by the partial blockage of that air passage, which causes the structures and the muscles in the throat to vibrate. All those muscles that are relaxed, they start to vibrate as they get narrower. If the airway gets even tighter, even narrower as those muscles relax, then the breathing can become shallow and you don't take as deep a breath. Or if those muscles really relax, they really come down, then the breathing may completely stop because the airway is just blocked off. Not breathing is called an apnea. So sleep apnea is not breathing when you're asleep. So again, the same thing that happens to everybody. Everybody's throat closes a little bit as we fall asleep, but if it closes too much, your breathing may be either too shallow or it may stop completely. And I thought I'd show you one picture of what we see in a sleep center, in a sleep lab, when we're testing people how they sleep. And if you can see my cursor, here is a portion of where somebody is breathing in and out, in and out, in and out, in. And all of a sudden, the breathing stops over here. Okay, and that's one of the ways that we can measure to see if somebody has obstructive sleep apnea and how frequently they have. As a matter of fact, if you can even see the bottom curve on this graph, you can see this line going down and down and down, and that's the oxygen level. So if somebody is stopping to breathe, their oxygen level goes down. What are the symptoms of people that have obstructive sleep apnea? Well, the first thing is that they're going to complain of feeling sleepy during the day, because without realizing, these people are waking up many times throughout the night. Every time they have trouble breathing, the brain is going to sense that, oh, something is wrong, and will wake them up. And so they'll wake up, their throat will open up a little bit, they'll breathe nicely, and then they'll fall back to sleep. Now, the vast majority of times, people do not realize that they're waking up. You need to be awake actually for about 5 or 6 minutes before you remember the next day that you woke up. So a common story, just to confirm that people may remember, is that if you wake up a small child, a 3-year-old or 4-year-old, to give them medicine during the night, and they take the medicine, they go back to sleep, they may not remember it the next day because they took the medicine, and people that young can fall asleep often very quickly, and they're not awake long enough, and they won't remember it. So the same thing with obstructive sleep apnea. Every time they stop breathing, they may wake up, but they may be only awake for 12 seconds, 15 seconds at a time, and then go back to sleep. They're not going to remember it the next day. So very frequently, I have patients that say, I've slept through the whole night. I have no problem sleeping. And then we do a sleep study with somebody with obstructive sleep apnea and find out that they've actually been waking up 100 times, 200 times during the night, and they have no idea about that. So because of that, they tend to be very sleepy during the day because their sleep is so interrupted. I spoke about snoring that can occur with sleep apnea. Sometimes people will remember that they wake up with a gasping sensation, that they're choking. Most of the time, they don't realize it, and it's somebody else in the house or the room that will say, oh yes, last night you kept on choking and gasping. Many times they'll complain that the next day, in addition to being sleepy, they have difficulty concentrating, they forget things, they may be irritable, sometimes it can lead or worsen depression. There are other things that people complain of. Sometimes it's waking up to go to the bathroom during the night. Now, there are many reasons to wake up during the night to go to the bathroom, so that certainly isn't the only one, but it is one of the causes. And sometimes when we treat people with sleep apnea, all of a sudden they tell me, boy, I don't wake up anymore to go to the bathroom. Well, as you can imagine, when you wake up several times during the night and when your oxygen level goes down during sleep and you're choking, it's associated with some things that aren't that good. So people with obstructive sleep apnea, they are at a high risk of various things, of heart problems, of strokes, diabetes, high blood pressure. So one of the reasons we want to treat people with obstructive sleep apnea is just from a health reason, that it's not healthy to have obstructive sleep apnea, and it's obviously much healthier to get rid of the sleep apnea. And that's in addition to people just not feeling as well as they should be, for those people that are feeling very sleepy during the day. There are a few different treatments. One of the treatments, and maybe the most common treatment, is something called CPAP, continuous positive airway pressure. And a lot of you may be familiar with it. It usually is a mask. It either is a small mask fits over your nose, or a larger mask fits over your nose and your mouth. It's connected to a small machine that usually is just by your nightstand. And it works by just simply blowing air through the mask with enough air pressure that it keeps the throat open. And as I mentioned, the problem with obstructive sleep apnea is that the throat is closing too much. So once we send that air in, it opens up the throat, then it gets rid of the sleep apnea. People sleep much better, and very often they then report that they're much more awake during the day. Another treatment is something called an oral appliance. It's a certain mouthpiece. There's certain dentists that specialize in it. And it's a mouthpiece that you put in your mouth during the night. It keeps the jaw forward a little bit. And by moving the jaw forward and the tongue forward, it opens up the back of the throat. A nice treatment. Doesn't work for everybody. For those people that it works, it's a simple procedure. There are also different surgical procedures that are used for sleep apnea. One is where they just cut some of the tissue in the back of the throat. That works in a few people. For more severe sleep apnea, it usually is not a treatment that works that well. There's a newer surgical procedure that came out a few years ago that people may have heard about. It's almost like a little pacemaker that you put underneath the skin, and it connects to the nerve that stimulates the back of the throat. And so while you're sleeping, that stimulation that we lose at night when we sleep, it gives back to keep the throat open. So that's one of the newer things for sleep apnea. And then there's some other things just to do in general to treat sleep apnea. One is weight loss. So if people are overweight, in addition to having weight everywhere, including their belly, everywhere else, they gain weight in their throat. And the more fat that's in their throat, the more it pushes in on the throat and narrows that airway. If you lose weight, then very often the throat opens up and the sleep apnea gets better. And for some people, it goes away. So it's a nice treatment. And anybody who's overweight, I usually try to push people to diet, to exercise, do what they can to lose weight. The next thing is alcohol. Alcohol calms down muscles, relaxes muscles. And so if you have alcohol before you go to sleep, it may produce or worsen sleep apnea. And I think you might have heard stories where people, if they have a nightcap before they go to sleep, those nights is when they snore loudly. The other nights that they don't. So alcohol is something important to avoid before you go to sleep for sleep apnea. Alcohol actually is something to avoid for anybody before you go to sleep. Many people think that alcohol is good for sleep. It actually sometimes makes you fall asleep a little bit quicker, but as it wears off, it fragments sleep. And so people that drink alcohol, their sleep usually isn't as good, isn't as efficient, and the next day people can be sleepier if they had some alcohol before they go to sleep. I wrote down here, avoid sleeping pills. Many of the sleeping pills also relax the airway, relax the muscles, and so can worsen sleep apnea. And then I'll just mention what I have here on the bottom, sleeping on the side or prone. Very often, a lot of people have obstructive sleep apnea that's worse when they're on their back. And that's just by gravity. So if you're on your back, the tongue and everything moves back and occludes and narrows the throat more. So for some people, just getting on your side or prone on your stomach will help the sleep apnea just by doing that, just getting off your back. And I'll just mention the first treatment, the CPAP, which is probably the most common thing that we use. The problem with the CPAP is that for some people, it takes a little while to get used to. And some people, they put it on and it feels funny and then they just throw it off and they never use it. And obviously it's not going to treat them. But if we encourage those people just to wear it every night, that after a while they get used to it, it becomes second nature, and it ends up being an excellent treatment. The next condition that I wanted to speak about a little bit is something called restless leg syndrome. This is a condition, a syndrome, which is not uncommon, and the main symptom is this urge to move the legs. So you get into bed and all of a sudden people have this urge to move the legs. They describe that sometimes there's a tingling, a crawling sensation in their legs, and every time they move it, it gets better. So they feel like they have to keep moving and moving their legs. It happens either only at night, or if it happens earlier, it happens more or worse at night. And obviously it can interfere with sleep. If you get into bed and you feel like you have to keep moving or getting up and walking around, then it can certainly interfere with your sleep. It may be associated with some other conditions. People that have some kidney problems, it's a frequent occurrence. There are people that are iron deficient that ends up with restless legs. Also, there are people when they're pregnant, that's when they get restless legs. That sometimes they have it, but it gets worse when they're pregnant. And some people only have had restless legs when during pregnancy. There are some medications that can worsen the symptoms. And I put down, I looked at this, it's that approximately 12 million Americans have restless leg syndrome. It may be even much more than that. The problem is that often people don't associate it with a medical condition or something to report to their healthcare provider. And so sometimes we don't have accurate data. But again, it's something that is not uncommon. The other thing that's important about it is that there's a high rate of success with treatment. There are different things, there are medications that can help, and sometimes there are medications that I say that can worsen the symptoms. And if that's the case, sometimes we can change their medications around. And I thought I'd show one other graph that we see during a sleep study. Here's somebody that has something called periodic limb movements, and that's often associated with restless legs. So if you see on this line, this is just a measurement of somebody's leg. This is their right leg. And you can see there's no movement. All of a sudden you see a lot of movement. And sometimes it wakes people up. So this is the EEG, the brain waves, and you can see it's a little denser over here because somebody has woken up. So this is something that we sometimes see with patients that have restless legs. The next condition that I'll speak about just briefly is narcolepsy. So narcolepsy is a condition where people feel very sleepy. That's probably the main characteristic that they have, the main trait they have. is they feel very sleepy during the day, and sometimes they have sleep attacks. Even in the middle of doing something, they say, I just have to lie down and get some sleep. Sometimes it's associated with some other symptoms. There's something called cataplexy, which is triggered by sometimes some emotion, sometimes laughter, where all of a sudden people lose muscle control. So if it happens, they have to hold on so they don't fall down. Or there's stories that they're telling a joke and they laugh, and all of a sudden the muscles of their face relax a little bit, and they can't speak for a few seconds. Something else that can happen is something called sleep paralysis. Now, this can happen with anybody, but it's more common with patients with narcolepsy. And that's where you get into bed, and before you even fall asleep, all of a sudden you feel paralyzed and you can't move anything, and then you fall asleep. Or something called hypnagogic hallucinations, and that's where you get into bed, and before you fall asleep, you start to dream, although you're still awake or wide awake. So everything looks like hallucinations because you're dreaming, although you're still awake. The cause of narcolepsy was found just about 20 years or so ago, and that's a deficiency in something called hypocretin. It's a chemical that's in the brain, and this is a chemical that sends out signals to other parts of the brain to produce other medication that keeps you awake and that stimulates you. So if you lose that, all of a sudden you're going to feel more sleepy during the day. It may occur in families, but it's still even infrequent in families. So the prevalence of narcolepsy is about 1 in 2,000. So it's not very common. If you have a family member, it's more like 1 in 100. So it's more common in families, but even in families, it's you don't find that many people because it's still 1 in 100 that a family member will have it. And one of the things that can occur with the symptoms that I spoke with is intrusion of REM sleep. Remember, I spoke about the rapid eye movement sleep, and that's the stage of sleep that we do some dreaming. And one of the feelings is that symptom where before you fall asleep, you start to dream even though you're awake. Well, it seems like that dreaming stage is coming in even before you fall asleep in patients with narcolepsy. There are certain treatments for narcolepsy. There's medications that help. Also, very interesting, people with narcolepsy can take short naps, which seem like it gives them that extra charge. So many patients that they say they take even a 5-minute nap or a 10-minute nap, and all of a sudden they wake up and they feel much more refreshed. So one of the treatments for narcolepsy is to tell people, take a scheduled nap every 4 hours or so. If you can lie down for 5 or 10 minutes, then it may help them a lot. The next thing I was going to speak about is shift work, which is very common. Some of you might be involved in shift work or did shift work. So the ideal sleep habit is for somebody 7 days a week to go to sleep and to wake up at the same time. So if you go to sleep at 10 o'clock at night and you wake up 6 o'clock in the morning, you do that every night, that's the best way to have good, efficient sleep and to feel refreshed the next day. Unfortunately, if you're a shift worker, that's going to vary. You're going to may do a shift that some days are 8 in the morning to 5 o'clock, and then next day it may be, or the next week it may be noon to 8 o'clock, and then another time it may be midnight to 8 in the morning. So that makes it more difficult to fall asleep, to stay asleep, and to be refreshed during the day. If you have to do rotating shift work, then the best thing to do would be to shift in a clockwise fashion. So again, if you're working during the day for a few days, then after that to do it a little bit later and then a little bit later, rather than to do it in the reverse, the reverse way, which makes it even harder to fall asleep. The other thing that I ask people who do shift work, if they can, is to keep that regular sleep schedule every day if possible. So if somebody is working, let's say 11 p.m. to 7 in the morning, and then they go to sleep at 9 in the morning, the problem is on their off days, they often just shift everything around and then try to go back to sleep at a so-called usual hour, which would be, 10 or 11 o'clock at night. So that's going to make it more difficult if their sleep patterns change back and forth. So from a sleep point of view, even if they're working at night, if they can go to sleep and wake up at the same time every day, that would be helpful. It's often very difficult because people like to do what everybody else is doing. So when they're off day, usually they want to go to sleep back at night and be awake when everybody else is awake, which obviously is understandable, but it makes it more difficult for sleep. So insomnia may be the sleep disorder that's most common. And it affects many people, and sometimes people have it a good portion of their life. Some people have it just periodically. And the problem is that once people have insomnia, then they start to do things that they think are helpful, but tend to make it even worse. So for example, if they're not getting good night of sleep, sometimes instead of being in bed for 8 hours, they'll say, oh, let me be in bed for 10 hours or 11 hours or 12 hours because I got to get more sleep. But that'll affect the sleep even more because the brain gets used to being in bed for such a long period of time. Then sleep gets kind of choppy because they'll sleep for a couple of hours, then they'll wake up, then there'll be a couple of hours, because obviously nobody in general can sleep for 10 or 11 hours. But if you're in bed that long, it's just going to make things choppier. Or people will feel tired during the day and they'll drink a lot of coffee and caffeine. Unfortunately, caffeine is something that often has what we call a long half-life, which means that when you have caffeine, it stays in you for a long time. I usually like people to take, if they're going to drink coffee or caffeine, to have no more than 1 or 2 cups per day, and to try to eliminate it after noontime. So a lot of people feel tired in the evening. They want to do something in the evening. They have coffee then, or a couple of cups of coffee, and that's going to stay in them throughout the night and make it even more difficult to sleep. And even if they fall asleep, they may wake up just because caffeine is something that tends to tell you to wake up. So there are a few things that we ask people not to do when they're not falling asleep. Another very common thing, which can lead to insomnia, but also can prolong insomnia, is all the technological things that go on. So if people can't fall asleep and they're awake, let's say 2 o'clock in the morning, they go on their computer and they start working on their computer. Well, that's very stimulating because you're concentrating, you're doing things, and also light is something that sends a message to the body that this is wake up time. And so if somebody on a regular basis is using their computers or their cell phones during the night, then after a while, the brain will start to sense that, oh, this must be wake up time. And so every night, the brain will automatically say, okay, it's 2 o'clock, it's time to wake up. So one of the things that we often do is ask people, again, keep regular sleep hours, no more than 8 hours in bed, try to eliminate light, try to eliminate doing anything that's stimulating, like computers. Also, don't do things that that take a lot of concentration. Don't do your bills during the night. Don't start cleaning up the house because you say you're awake anyway. All of that will make it harder to fall asleep, not only that night, but the subsequent nights. Because again, your brain gets used to certain patterns. And if you do that, you're going to start waking up every night at the same time. So just a couple of tips to help sleep better. Minimize light, noise, and extremes in temperature in the bedroom. I think that goes without saying, that people are probably familiar with that. Avoid caffeine within 6 hours of bedtime, but I would say even longer than that, because sometimes, especially if you have more than 1 cup of coffee at a time, that caffeine level will last in your body for a much, much longer period of time. So I usually like to say after about noontime, after about lunchtime, no more caffeine. I talked about alcohol, trying to avoid that within 4 to 6 hours of bedtime. Also, avoid nicotine close to bedtime or during the night. Obviously, my recommendation would be try to quit smoking completely for anybody that's smoking, but also it can be stimulating at bedtime. People think that it often is relaxing, but nicotine can sometimes also stimulate you and interfere with your sleep. Also, generally avoid strenuous exercise right before you go to bed. Many people think, oh, let me exercise like crazy because I'll feel tired and I'll feel exhausted and then I'll fall asleep. Well, actually, exercise can stimulate you also. So if you do that right before you go to bed, sometimes that can keep you awake. Just a couple of comments about sleep schedule in aging. Some people with aging, they have what's known as advanced sleep phase, which means they tend to go to bed a little bit earlier and they wake up a little bit earlier, which is okay if they're getting regular hours of sleep and enough sleep. But a lot of people are uncomfortable with that and would like to stay awake a little bit longer and get up when everybody else gets up. And so treatment for that often is to do the bright light in the evening. As I mentioned before, bright light tends to send a signal to be awake. And so it may keep people awake a little bit longer and reset your internal clock where you go to bed a little bit later and wake up a little bit later. And by the same token, avoid sitting in a dark room during wake hours. So during the day, if you sit in a room and the light is down and it again may send a signal to the brain that this is more like sleep time, and at night is more like wake up time. And I bring that up also in terms of aging and for anybody who's in a nursing home, that sometimes they turn the lights down a little bit too much during the day. And so their whole sleep cycle sometimes starts to reverse, and people end up getting a little bit sleepier during the day and more awake during the night. I wanted to mention something called REM sleep behavior disorder. I talked about REM sleep and a few times, but there's one condition where during REM sleep at night, people tend to act out their dreams. As it turns out, when we go into REM sleep, we're paralyzed. And that's probably by evolution, so we don't act out our dreams. But there are certain conditions that people have that can actually reverse that and get rid of that, what should be normal for people to be paralyzed during REM sleep. And for those people, it can be dangerous. If all of a sudden they're dreaming that they're fighting off some attack or some warrior, they can go out and flail out and try to punch, and they can hurt themselves or hurt a bed partner. So that's something that you should seek medical help if that happens at all. Pregnancy can disturb sleep, as probably most people know, and for a lot of reasons. I mentioned already about the increased incidence of that condition called restless leg syndrome, but also you can have episodes where you're waking up to go to the bathroom, where there's more heartburn, where there's nausea, and just general physical discomfort. So many patients with pregnancy do have some sleep problems. And just to mention another time that causes sleep problems, menopause, hot flashes during sleep can interfere with sleep. There's an increased amount of insomnia. And as it turns out, men probably have obstructive sleep apnea a little bit more than women, but after menopause, it starts to increase also in women. So I think I'm going to end there, and I'll be happy to take some questions.
Great, thank you so much, Dr. Goldstein. So if you have any questions, you could type them into the chat box. And we already have some questions in there. So one of the questions are, how do you feel about melatonin?
So that's very interesting. Melatonin is actually a chemical that the brain makes. And as it turns out, when we're about ready to go to sleep, the body sends out the signal of melatonin, which starts the whole process to shut down the stimulation to some parts of the brain to allow you to go to sleep. I think we use it from a medical point of view, from a sleep medical point of view, mostly to try to adjust people's schedule. So there are some people, let's say they did work a shift night and now they want to shift their schedule a little bit, or they have that condition called advanced sleep disorder, where they're going to sleep a little bit too early and they're waking up early. So very often we use melatonin to reset the body's own circadian rhythm, the body's own sleep cycle. As a sleep medicine for insomnia, um, it's probably not that great. It may help initially. It seems after a while, it probably isn't that good. Now, I've had many patients that say they take melatonin and it really helps them. So everybody may be a little bit different. But I think from a medical point of view, I like using it when I need to reset somebody's schedule. In terms of insomnia, I think it helps some people, but I don't think it's a great sleeping pill.
Thank you. And so going along those lines, another question, is lavender smell useful for going back to sleep?
Interesting. There's a lot of things that people use that I think is very helpful, very beneficial. There's nothing specific from a medical point of view that says that kind of smell will be great for sleep. But there's so many people that there are just certain things that they just get used to. I mean, there's some people that still hold on to a stuffed animal and they just go to sleep. So there are people that different smells, different things that help them fall asleep. So I think if you're one of the people that use it and it helps, then I think that's that's good. As I say, there are no specific studies that I'm aware of that have shown any particular aroma or smell or whatever that as a rule would be prescribed to help people in general. But I think there are a lot of individual differences.
Okay. And then would you recommend a sleeping pill if it's necessary?
Um, I think the answer is if necessary, yes. Um, but everybody is different. So very often people do better. We're just getting their habits better, sleeping on a regular time. Sometimes people who keep waking up in the middle of the night, we have them, they can't fall back to sleep, just get up, go somewhere and relax. And then when they're sleepy, they can get back into bed. So there are other things that we can do to try to get people to sleep, relaxation exercises. But there are some people that need sleeping pills. And there's some people that need a combination of those things. So I think for some people, sleeping pills are very helpful.
Okay, thank you. And can you tell us a little bit about the home sleep study versus the sleep study done in the office?
Yeah, so the home sleep studies um, are specifically for people that were looking for obstructive sleep apnea. And it came into to being probably on a regular basis about 5 or 6 years ago, and it really seems like it helps a lot of people. So before that, virtually everybody had to come to the sleep center and get hooked up with a lot of wires. And those studies are very nice because we can measure a lot of things. But if we're just looking for sleep apnea, then very often the home study can give us the information that we need. And there are a couple of different types of home studies, but they're all much less involved than the studies in the center. There's one of the common ones is a belt that goes around around your waist, and then you put almost like a little nasal cannula to measure your air movement to see if you stop breathing, and then something on your finger to measure oxygen level. There's another one that goes on your head, measures some brain waves. And then from there, you can measure your, it comes down with a nasal cannula to measure breathing. So I think the home studies are very good for a lot of people if we're just looking for sleep apnea. Now, if they have some other conditions in addition to looking for sleep apnea, sometimes people with certain cardiac disease or people with certain lung diseases, we still need to do the full sleep study because we have to measure and check other things at the same time. But I think for a lot of people, the home study is something that can be done and makes it much easier for patients.
Okay, thank you. And then are there certain CPAP machines that are better to use than others?
There are a few companies that make the machines, and those are all good. So the top 2 or 3 companies or those machines are very good. But if you're asking me the types of CPAP, there's something called CPAP, there's something called BiPAP, there's something called AutoPAP. So CPAP stands for continuous positive airway pressure. And the way we figure out the pressure for that is often with a sleep study. And while somebody is wearing it, the technologist is slowly raising the air pressure until they can see that there's enough air pressure to make sure their throat stays open. And then we prescribe that. So let's say that's 10 centimeters of water, just the level of pressure. Then we set that up. And so somebody puts that mask on every night and uses that. There's something called BiPAP, which is bi-level positive airway pressure. And that's where we set the inspiratory pressure, the pressure that we take a deeper breath, make that a little bit higher than the expiratory pressure. That's the pressure that's in there when we're blowing out. And there's a few reasons to set it up as BiPAP, one of which in some people, it's a little bit more comfortable because as they're blowing out, the pressure going in isn't quite as much. And then there's another thing called AutoPAP, like automatic positive airway pressure. And that's good also. That's something where we set a minimum airway pressure and a maximum airway pressure. And the machine by itself will adjust to see how much pressure that you need to keep the airway open, to keep the throat open. So those are the different types of pressure. Is one better than another? Not necessarily. I mean, there may be reasons why we use one rather than another, but they're all excellent, and they all should do the should do the job for treatment of sleep apnea.
Thank you. And how do you sleep past getting up at night to use the bathroom?
I'm sorry. How do you do it?
So how do you sleep after you get up at night and use the bathroom?
Okay. So, right, there are a lot of people, they wake up to the bathroom, then they can't go back to sleep after that. And it's tough, but I think one of the things is to, again, concentrate on trying to get regular hours of sleep every night. So stay in bed for those 8 hours and try not to take a lot of naps during the day. I usually like people to avoid naps in general, because if you have naps during the day, it may interfere at night. So sometimes people wake up and then if they can't get back to sleep, then they start to take naps during the day. And the more naps they take during the day, the harder it is to fall asleep. Or another thing that people do is, let's say they wake up at 3 o'clock to go to the bathroom and they're awake till 4 o'clock. Then instead of waking up at their usual time, which might have been, let's say, 7 o'clock, they stay in bed until 8 or 9 or 10 to try to make up the sleep that they lost. Well, once they do that, then again, the brain gets used to, okay, I'm going to sleep for 4 hours. I'm going to wake up for an hour or two. Then I'm going to go back to sleep for 4 hours. And your brain just gets used to that same pattern. And then you have to break that pattern. So those are some of the things that you have to do. The other thing, by the way, again, if you have to go to the bathroom during the night, just see your healthcare provider to see if there's any other reason why that's happening. Is there some bladder dysfunction? Is there a prostate problem? Is there some diabetes that's not under control? Are you drinking too much water at night? Sometimes people, before they go to sleep, drink, a big jug of water, and then, they're going to be more prone to getting up during the night. So you want to make sure that there isn't a particular reason, medical or otherwise, that you're waking up. But in addition to that, again, it's important just to keep a regular sleep hours.
And then what do you recommend for people who are fasting during the month of Ramadan and have to wake up in the middle of the night to eat, and then they can't fall back asleep after eating?
Yeah, that's a very good question. I don't have a great answer, other than to say, as best as you can, try to still keep your sleep hours. So if you don't get, let's say, a full 8 hours of sleep, and you get, that night you're only getting 6 hours of sleep, try to get up still at the same time that you usually get up. Because again, if you stretch out the time that you're in bed, then every night your brain is going to start to say, okay, it's time to wake up to eat for a couple of hours, and then and then you'll have trouble falling back to sleep, and then you'll sleep a little bit later. Having said that, this goes to anybody, is that if you're limiting yourself to wake up at your usual hour at 7, which I usually like people to do, even if they had a bad night of sleep, just be cognizant of what you're doing the next day. I don't want you to get only 5 hours of sleep if the next day you're about to drive for 4 hours somewhere, or you're going to operate some machinery. So always, if you have a bad night of sleep, or if you're following the general rules, which is to try to wake up at the same time, no matter if you didn't have a good night of sleep, just be careful. That doesn't always hold true if you're about to do something that may be dangerous if you don't have enough sleep the next day.
Okay. There's a question about what happens if you take sleep pills daily for a long time. Like, what sort of side effects are there?
Well, I mean, there are always possible side effects of any pill. So you can read the warnings, but in addition to that, if you take a sleeping pill every night, then for some people, it may be harder to fall asleep if all of a sudden you stop the sleeping pill. And obviously the goal, I think, for most people is to have a good night's sleep without a sleeping pill. So if all of a sudden you've taken a sleeping pill for a week or a month, or sometimes for some people several years, all of a sudden if you stop using the sleeping pill, it may be a little bit harder to have a full night's sleep, or harder to fall asleep. But for those people, we go back to all the things you should be doing: regular sleep hours, don't play on the computer, don't clean the house, don't do all the things that you have to do, and then usually we have good results with people getting back to sleeping, hopefully without a sleeping pill.
Okay. And then another question along those lines, would you recommend any homeopathic pills, for example, keto PM pills?
So that is a good question, because that comes up also. At the moment, there are no pills, no homeopathic pills that have been shown to improve sleep. Now, that doesn't mean it doesn't. That doesn't mean that in some people, it won't help. We don't know. But at the moment, there's been nothing, no studies out there that anybody can recommend to say, use X, Y, or Z homeopathic pills. So at this point, I don't have any recommendations to use it. The other things, don't forget that, I mean, many of the pills, may have some benefit. We don't know that yet, but always be careful, because some pills, even if they're homeopathic, also can have possible side effects as well. So just try to recognize both the possibilities, the benefits, and the possible side effects.
Okay. And then another question, why are there some nights that I'm still awake at 4 a.m. and other nights I can just sleep like a baby for 10 hours? It usually happens in cycles.
Yes. So that's not an easy answer. Everybody is different, and sometimes there is something that is changing in people that have cycles, whether it's times of stress, whether it's times of eating, whether it's without realizing caffeine, whether it's naps or whatever. But a lot of times we can figure out what's changing from time to time, and people do complain about that, and we don't know. But I would go back to, again, try to follow the good sleep habits. And sometimes if you're making it up with that 10 hours of sleep, it may interfere with another night of sleep if it's not that usual, going to bed at the same time and waking up at the same time. So I don't have a great answer of why it's happening, but just we always want people to get back to the good habits, to try to get back to sleep as best as you can.
Yeah. And then another question, how do you learn to shut off your brain from the daily drama of life? So, so that way you can sleep, right?
Another good question, and a difficult question, and everybody's different. So that isn't a one answer for everybody. There are some things to try. One thing which sounds silly, but I find that it works for a lot of people anyway, is if it's sometime before you go to sleep, or not right before you go to sleep, because I don't want to do anything stimulating before you go to sleep, but let's say at 8 o'clock at night, take out a pad or a piece of paper, write down all the things that you have to do the next day. You have to call so-and-so, you have to speak to a cousin, you have to make sure you file the right form for something or whatever. Write it all down. And that way, if at night, as you're falling asleep, or if you wake up in the middle of the night, sometimes it's a little bit more relaxing. You don't have to keep saying to yourself, boy, I got to remember to do this, or this. If you've written it down, you say, okay, I'm not going to forget it. I wrote it down already. So it sounds silly, but for a lot of people, that really helps. There's also different relaxation exercises. Sometimes there are different muscle exercises that help people. You can concentrate, for example, the things to concentrate on tightening and relaxing different muscles, or trying to relax the muscles around your mouth or your eyes, the things like that. There are also things that you can concentrate on. You can sometimes start with the alphabet, start with letter A, think of somebody's name with A, and then B, and then C, and then just go down. So instead of thinking about all the other worries that you may have, you try to do that. There's one exercise that I've had a couple of patients do, and they've told me that they like, is you could try to name all the presidents. You start go to sleep and you start saying, okay, George Washington, Adams, Jefferson, you keep going, and then hopefully sometime before Lincoln you're falling asleep. But there are things like that which sometimes to do. But the other thing is, if you're asleep, if you're not asleep and you're in bed and it's 2 o'clock in the morning and just can't shut your mind off, very often I do what I mentioned a couple of times. I tell people, rather than drive yourself crazy in bed trying to worry, or you can't shut your mind off, sometimes getting up, sitting somewhere, maybe in a room down the hall, but with the lights down, and just relaxing, don't do anything, and then when you're tired, then go back to bed. Because sometimes you're in bed and you can't shut your mind off, and then you start driving yourself crazy that you're not sleeping. But rather you get up and relax somewhere, and then when things are calm, then get back into bed.
Okay. And so just one final question. Is it better to take melatonin before going to sleep or when you wake up in the middle of the night?
So I would not do it in the middle of the night, for a couple of reasons. First of all, by then the body has probably made some melatonin already. Also, if you end up taking melatonin too late during the morning, what can happen is that it may do just the opposite. It may convince the brain that you want to go to bed later and go to sleep later. So during the night is not a good reason. It's not a good time to take it. You could take it before you go to sleep if you think that it helps you as a sleeping pill. When we use it to readjust somebody's cycle, as I mentioned before, then the time to take it actually is about an hour and a half or 2 hours before the time that you usually go to sleep. And that's because that's when the brain usually makes melatonin. The brain usually makes it. So if you're usually going to bed, let's say at 11 o'clock at night, the brain starts to make melatonin about 9 o'clock at night to try to lead your brain up to the point where 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 you're going to go to sleep. So again, the main thing though is part of that answer again is no, I would not take melatonin during the night. That usually isn't helpful.
Okay. All right. So thank you so much, Dr. Goldstein, for taking the time to present on this topic and for answering all of our questions.
Yeah, my pleasure. Good luck to everybody.
All right, thank you. And then our next Lunch and Learn with Hackensack Meridian Health will be Complications of Diabetes on Tuesday, May 4th at 1 p.m. Learn about how diabetes affects your body, including your heart, blood vessels, eyes, and kidneys, and what you can do to lessen the effects. For more information or to register, check the library's events page at ebpl.org/calendar. And thank you everyone for joining us for today's talk, and take care and stay safe. Okay, thank you.
Thank you for joining us for this week's Encore presentation. To join us for live programs or to learn more about the East Brunswick Public Library, visit our website at ebpl.org.